doctors call it a silent problem. That's because so many patients don't know they have osteoporosis until they break or fracture a bone. And now more young people are developing osteoporosis. Here's Dr. Mallika Marshall with a look at who's at risk and why.
Old and frail. That might be the cliche of an osteoporosis patient.
We also look at the spine.
But Dr. Nathaniel Clark of the BI Deaconess in Plymouth says to think again.
Far more commonly, what we're referring to are people generally, say, in the 40 to 60 year range that are being looked at more carefully than previously.
I was in my early 50s.
That's when Faye Lakeman found out her bones were slowly deteriorating. Today, both she and her husband Dan are getting around fine, despite the fact that he's also being treated for severe bone loss.
You're constantly aware of the dangers of making a wrong move with a broken bone.
What concerns doctors is something referred to as secondary osteoporosis, which means the bone loss isn't attributed to just aging, but it's accelerated by other factors.
I'm on a significant number of medications, and I think there may be a certain aspect of that.
Vitamin D and calcium.
Dr. Ann Babbitt is a bone and joint specialist in South Portland, Maine, and runs a support group for osteoporosis patients. She says many widely prescribed drugs can hurt bones over time.
Many people are on prednisone, and that's probably the one that you hear about the most and is a definite medication that is not good for bone health.
In addition to steroids, other drugs of concern include some narcotic pain relievers, antidepressants, and anti-seizure medications. The problem? Many patients now take these drugs for years.
All of these can be a setup for damage to the bone and the onset of osteoporosis much earlier than we normally would think of.
Absorbing nutrition properly also impacts bone health. Patients with celiac disease and inflammatory bowel syndrome can also be at risk earlier.
You're not absorbing nutrients as you should.
So why do we doctors prescribe these drugs if they have this side effect? Well, it's all about balancing the pros and cons of any drug. And many of these other conditions are also very serious. If you're concerned you might have weakened bones, ask your doctor about whether you should have a bone density study. I'm Dr. Mallika Marshall, WBZ News.